Alright, so then let's look further. So we have our trachea, and the two main branches are your bronchi, but and you have your primary bronchi. These are the first branches that come off your trachea. So you go from, again, your oral cavity and your nasal cavity. They meet at the pharynx. From the pharynx to the larynx to the trachea to the primary bronchi. And again, you have a left and right because they have to diverge into left and right lung. And then you have your secondary bronchi, which you get smaller. And then you have tertiary bronchi, which branches and gets smaller. And then you have your bronchopulmonary segment, which includes even smaller bronchioles. And then you finally have a terminal bronchiole. So again, terminal means the end of something. So now these passageways are finally reaching their end destination. What's the end destination? Well, their end destination is the respiratory zone. So you still have some smaller bronchioles, even more smaller bronchioles called respiratory bronchioles. But now we reach these things that look like little grapes. And whenever you have something that looks like grapes, they tend to call it alveoli. So you have your alveolar ducts that are connect alveoli, and your alveoli themselves, these little bumps right here. Now, the thing is that we have to cover two things, some vocab. So what we have is the conducting zones and the respiratory zone. Now, what's the conducting zone? Well, again, you have to get air gases into your body and out of your body, right? So the conducting zone is just a way of getting everything from the environment to your alveoli and everything from your alveoli back into your environment. So this is a concept that's sometimes called bulk flow. So it's just getting from point A to point B. Point A being your environment, point B being your alveoli, and back and forth. So they're not really about actually oxygenating your blood. They're just a way of getting air gases from your environment to the inside of your lungs, and from your inside of your lungs back into the environment. So they're just passageways, and they're not directly involved in gas exchange. So these structures, so basically everything outside of that smaller box we saw earlier, they're just a way of going from point A, from the outside environment, to point B in here. Now the respiratory zone, these include the very, very, very small respiratory bronchioles and the alveoli. So these are actually where your blood gets oxygenated and also where you unload carbon dioxide from your blood. So these are areas where you actually have exchange between the air that you breathe in and your bloodstream. So everything outside this area, you do have air, but it's not actually interacting with your blood yet. Now let's look at the respiratory zone. So actually your respiratory zone should be right here. Like the terminal bronchiole, that isn't actually part of your respiratory zone quite yet. It's still just away from getting from your environment into your alveoli. So your respiratory zone is right here. And what we have here is all these capillaries that came from those pulmonary arteries and lead to the pulmonary veins. So this is where you actually have that change from deoxygenated blood coming from your pulmonary arteries to the oxygenated blood that returns to your left atrium, right? So what we have here, all these alveoli, these little chambers of air sacs that interface with these capillaries that exchange gases. And I like the Martini version. It's a lot going on here, but I think it shows the difference between the terminal bronchioles and the respiratory bronchioles a little better. So what we have here, you notice that a lot more things, especially the smooth muscle, is wrapped around the bronchioles. And the thing is that the smooth muscle actually allows your body to change the diameter. So by contracting the smooth muscle, you can actually make these bronchioles smaller, and when you make a vessel smaller, what happens to the flow? Well, this is the cool thing about your respiratory system. A lot of the physiology, a lot of the physics that happens in your blood vessels also applies to the bronchioles. So as you have a radius of a tube getting smaller and smaller, same with your bronchioles. If the bronchioles get smaller, the flow decreases. So you slow down the rate of gas exchange and breathing. Now, what we have here is that, notice that these alveoli, and it's hard to see in the respiratory bronchiole, but the respiratory bronchiole has less of this smooth muscle. And what we see is that this alveoli, they don't actually have smooth muscle. They have elastic fibers. So what we have here, or actually go back to our bronchioles. So the thing is that Sympathetic activity activates these receptors called beta-2 adrenergic receptors. So things like norepinephrine and epinephrine, these are going to bind to these receptors. And what they do is that they can actually cause your airways to open. So this is a great thing. So this is why you have like anti-asthmatic drugs. So things that with asthma, what can happen is that the mucus in these bronchioles can get thicker, but you can also get the smooth muscle contracting and constricting and narrowing these bronchioles. But when you have something that activates beta-2 adrenergic receptors, such as like something like Ventolin or salbutamol, that actually causes like sympathetic like activity. So if you've ever had like that fight or flight response and you notice what happens to your breathing, you start breathing kind of faster and deeper. Well, this actually facilitates this by activating the sympathetic activity in your bronchioles. That actually causes them to dilate and open up. And again, just like our Poisson equation with blood flow, by increasing your radius, you decrease resistance and increase flow. So that's why that equation is very useful.